right, so before I continue on with like the supportive care side of things, I got a little story for that, so I'm going to come back to it if I have time. Some of these statistics from the American Cancer Society on throat cancer is with laryngeal cancer. In 2019, there were 12,410 new cases, little over 9,800 in men and 2,500 in women. Of that 12,410 new cases, 3,760 of those cancer patients ended up dying. 3,000 of those were in men, and then 750 of those were in women. There's a decreasing in the number of new cases, ranging from about 2 to 3% a year because of the decrease in smoking, which is crazy, that it's 2 to 3% just because of less smoking is what they're thinking is why that is so low. It's becoming less. The Department of, and bear with me on how to say this, otorhinolaryngology. It's a department. They dedicate themselves, it's a dedicated department to advancing treatments for head and neck cancers. So that was a little bit of that. And now on to my little story. So my father was diagnosed in the summer of 2015 with hypopharyngeal or laryngeal pharyngeal cancer. Very hard to say. He survived. It was throat cancer, obviously, that was in his throat, and it also was partially on his thyroid. He did, I don't remember what stage it was, but they ended up doing radiation, and then he went through chemo, and they ended up cutting out part of that on his, part of that tumor on his neck. He is cancer-free, so that is awesome, but what I wanted to talk about mostly was the supportive care behind it. It is so big because it attacks, it's your throat, so that is your eating, your drinking, your talking. Literally, when you're going through this type of cancer, all of that is taken away. He was put on a feeding tube. He couldn't eat or drink anything through the mouth. We had to help him do mouth swabs. We had to help him do oral care. He's still battling with decaying of his jaw and his teeth because of the severe chemo radiation and all the meds that he was on during that time. So he's still, years later, is still dealing with the side effects of having this type of cancer. So it's very, very hard just watching your loved ones go through that because they can't eat, they can't drink, they can't do anything. And he was about 190-ish, I want to say, 190 pounds. And during this time, his lowest weight was 107. He has not ever been able to gain that weight back. He's only gotten up to, I think, 145 max, I think was what his max weight was. He's finally able to eat and drink everything. But yes, the supportive care, the support behind this is so, so, so big, and I cannot stress that enough. It's like that with any cancer, but I know that this affected my family right after a hard time, so I know how much the supportive care is stressed on this type of cancer because they literally lose every function between dry mouth, eating, drinking, and talking. He couldn't communicate for a couple months because of it. So